Understanding your daughter's irregular periods.
Hello, parents, and anyone else interested in understanding more about menstrual cycles, especially in younger girls. Today, we're going to talk about irregular periods in preteen girls and whether it's a cause for concern.
What is normal menstruation for a preteen?
First, let's define what's considered normal. Girls usually begin to menstruate between the ages of 9 and 16, with the average being around 12. These first few years after the onset of menstruation are known as the menarche period, and it's a time of significant hormonal change for your daughter. It's very normal for girls in this phase to have irregular periods. Irregularities can involve the length of her cycle, the amount of blood flow, or the duration of her period. She might skip periods, have them close together, or experience variations in the intensity of menstrual symptoms.
When should you be concerned?
There are some situations where irregular periods might be a sign of something more serious. If your daughter's periods are very heavy, requiring her to change a tampon or pad every 1 to 2 hours, if she's experiencing severe pain, if her periods last longer than a week, or if she's not had a period within 3 years of breast development, then these could be signs of a medical issue such as hormonal imbalance, blood clotting disorders, or other conditions. Moreover, signs like sudden weight changes, excessive hair growth, severe acne, or signs of distress like mood swings, anxiety, or depression may suggest underlying conditions like polycystic ovary syndrome, PCOS, or an eating disorder. In these cases, you should seek medical advice. Remember, it's always better to err on the side of caution when it comes to your child's health.
How can you support your daughter?
During this phase of change, your daughter may have many questions and concerns. It's important to keep the lines of communication open, reassure her that these changes are normal, and provide emotional support. If your daughter is uncomfortable or worried about her periods, it may be a good idea to schedule a visit to a healthcare provider. They can provide more in-depth information, reassure her about what's normal, and investigate further if there's any cause for concern. Encourage her to keep track of her menstrual cycles, which can also be useful information for the healthcare provider. In conclusion, while regular periods are quite normal for a 10-year-old girl who has recently begun menstruating, certain symptoms may indicate the need for medical attention. However, remember that every child is unique and develops at her own pace. And most importantly, your support and understanding during this time of change is crucial. Here's hoping this video has been helpful. Remember to always consult with a healthcare provider if you're in doubt,